If a patient dies from cancer, we mourn. If he dies from a heart attack, we understand. But if he dies from a cosmetic procedure, a voluntary procedure, a hair transplant procedure, it's an indictment on the entire medical community. Good morning. What I'm going to share today is not just another tale from the operating room, but a wake-up call. In the field of cosmetic surgery, surgical hair restoration, where confidence is restored one follicle at a time, a hair transplant is supposed to be a celebration of science meeting self-esteem. But every now and then, reality throws cold water on our idealism and reminds us, painfully, that in the wrong hands, even the safest procedure can turn deadly. A few weeks ago, I warned in a video that the writing was on the wall, and now tragically, that writing has turned into an obituary. Today we discuss the two deaths in Kanpur in quick succession, the Kanpur catastrophe. On March 13, 2025, Vineet Kumar Dubey, a young promising assistant engineer, walked into a clinic for a routine hair transplant, but he never walked out. The very next day, his wife was told that he had developed gross facial swelling. He had been hospitalized, and despite all efforts, after 2 days, he was gone. It would be poetic if this was an isolated incident, but poetry belongs to art, not to autopsy. This was the second death in that very clinic. The first swept away quietly under the rug until the second fatality forced open the closet where skeletons were being neatly stacked. Let's be clear, complications are a part and parcel of surgery. We do our best, but risks do remain. But death, that is never a part of the bargain, especially not in a field where patients walk in voluntarily, in completely good health, for a cosmetic procedure expecting rejuvenation, not a coffin. Hair transplant, when done responsibly, is a marvel of modern medicine. We take hairs from the back of the head and the sides, and sometimes the body areas, by two techniques, either FUT or FUE, and implant them into areas which are thinning or bald. With proper technique, the results can be life-transforming. But when you cut corners, lives, not just hairlines, are lost forever. So what went wrong in Kanpur? The devil always lies in the details, and that's what we're going to discuss today. Number one, unqualified practitioner. As we go through the newspapers, the news reports, police is looking into the credentials of the clinic, of the doctor, as if that should ever have been in doubt. A clinic not equipped for medical emergencies, medical responses. A high-volume model chasing profits instead of prioritizing patients. And that is the very reason I tell my patients to go and visit the clinic first. Spend a day at the clinic. Your sixth sense will warn you if you feel uncomfortable. No resuscitation gear, no fallback protocol, not even a basic understanding of what to do when things go south. And this isn't a one-off, it's a pattern, a rot that's spreading. Infection, sepsis, shock, anaphylaxis, cardiac arrest, all these are known risks, but they don't cause fatalities when managed by trained professionals in well-run clinics. Too often, death does not happen due to a complication. It happens because the response was too slow, too sloppy, or simply non-existent. And there are 6 silent killers, the fatal cocktail, that I'm going to enumerate now. Let's break it down into 6 points. Infection and sepsis. Bacteria often seeded by poorly sterilized instruments in overcrowded setups. One tiny lapse in asepsis can become a full-blown systemic catastrophe. And if the patient, God forbid, was a silent diabetic, it's a ticking time bomb. And then anesthesia mishandling. Local anesthesia may sound very benign, but it requires precision. A wrong dose, a rushed hand, and suddenly the patient's heart is put at risk. Hemorrhage and consequent hypovolemia, blood loss. Excessive bleeding, especially in large megasessions, can spiral slowly into shock if you're not prepared. And then allergic reactions. From antibiotics to anesthetics, the body can revolt. You need trained hands, you need trained eyes, efficient, fast hands to save that life. Clots and embolism, dehydration, immobilization, or an undiagnosed clotting disorder can send a clot hurtling towards the lungs. Result, sudden collapse. And then pre-existing illness, diabetes, hypertension, cardiac illness. Many patients don't even know that they have them. And if no one asks the right questions beforehand, disaster strikes and all is lost. The real tragedy is profit before prudence. Many of these so-called clinics are sweet shops in scrubs, churning out patients like fast food joints dish out burgers. No pre-operative assessment, no patient education, no safety net whatsoever. And when the worst happens, the clinic shrugs off responsibility faster than a cat shakes off water. After all, the technician did it. The doctor only posed for Instagram reels. At Darlingbar's clinic, my philosophy is simple. One doctor, one patient, one clinic. At any given point of time, only one patient is being operated by me, and I do all the surgical steps myself. If we have two clinics, one in Mumbai and one in Chandigarh, if I'm operating in Chandigarh, the Mumbai clinic is closed. They do not run simultaneously. They cannot, because I am the person who's doing the procedure. No middlemen, no assembly line approach. I personally handle each and every surgical step, from consultation to design, anesthesia, harvesting, and slit creation. Because every step counts, because every life matters. So what should the patients look out for? So let me leave you with a checklist. Because in the marketplace of modern medicine, the buyer must beware. Check the doctor's qualifications. Check whether the clinic is actually what it appears on Instagram. Don't go by fancy Instagram reels or by websites. Ask for medical council registrations. Insist on seeing the operation theatre. A clinic like ours will also show you a procedure being done. So inspect the clinic. Does it smell sterile or it's messy? Meet your surgeon. Insist on meeting him. If he is missing till the day of the surgery, you're better off walking away, because after the money is paid, you're not going to see him again. Ask about emergency protocols. If they blink, just run. Don't chase discounts. Yes, ask for an affordable procedure, but do not chase unrealistic discounts. You're not buying shoes. You're investing in your safety. Avoid crowded schedules. Hair restoration isn't a race. It's a responsibility. Spend a day at the clinic. Absorb the goings on. If you feel uncomfortable, look elsewhere. So let's draw the line here. As I said before, if a patient dies of cancer, we mourn. If a patient dies of a heart attack, we understand. But if a person dies from a hair transplant, a voluntary procedure, it's a shame for the entire medical community. So let us not normalize these tragedies. If we keep brushing these deaths under the carpet, soon we are going to trip over the pile. To conclude, to every hair transplant patient who's watching, demand accountability, ask hard questions, because your life is worth more than a discount and a dream sold in a glossy ad. To every doctor listening, let us rise above the noise. Remember the oath we took, not to grow rich, but to first do no harm. Because at the end of the day, every single strand that we plant on the head should be a symbol of hope, not a silent tombstone for a life cut short. Thank you for watching. Please share this message. Let's make safety fashionable again. Have a nice day and God bless you.
So you thought you got it made for easy living, slipping out the back door.